and what are the premiums, and what are the costs to individuals. So all the other stuff that we're talking about and working on, the governor always makes it real. So I'll relay to him that that's your bottom line as well. I also am very happy to be here with the other panelists. I've had a chance, some of us have already had a chance to discuss our positions on various things, but one of the great things about this panel is, the reason that Massachusetts has been successful in doing Part 1 of healthcare reform, which was really designed to get everyone in the state covered, is because there's something in Chapter 58, that historic bill signed in 2006, that represents something positive for consumers, for business, for advocates, for the payers of health care, and obviously there's a huge role that government plays. So the partnership, the coalition of business leaders, patient advocates, the healthcare payers in the state, and government to come to agreement on that is the way that we were successful in making healthcare reform Part 1 work. And if we don't keep that partnership together at a high level, statewide level, I don't think that we'll be successful in Part 2. So I think it's great that we have this panel that represents those factions of the partnership. And as I said, healthcare reform Part 1 has been successful. 98.1% of people have some form of health insurance. 99.8% of kids are covered. I often say that I feel like I can just go to community to community and find that one child that's out there that doesn't have insurance and get everybody covered. But the issue is, quite frankly, we can't sustain the progress or the success that we've made in getting near universal coverage if we don't bring health care spending down. Massachusetts spends about $66 billion right now on health care on an annual basis, $66 billion. In 2020, the projections are, if we don't do something, we'll be spending $120 billion on health care. As you all know, that means that it's squeezing out other things that we should be investing in, whether it's innovation, investment in new businesses coming in, our schools, infrastructure. I know you have one of your topic forums is going to be on transportation. Our transportation system is crumbling. So it's squeezing out other things, and that's true not only at the high policy level, but we know it's true for families as well. The governor and the legislature have done a lot of things to try to bring down the cost of health care, especially for small businesses in the last
So I'm going to tell you about a couple of my clients, and in the interest of their privacy, I've changed their names. And they look like this, but these are not their photos. But Cal, man I'll call Cal, is indeed a veteran of World War II and has had some hearing loss over the years from his time in loading the big guns on his destroyer in the Pacific. At this point now, many years later, he's age 88, has a girlfriend. They're adorable, they're really a cute couple. But he now has atrial fibrillation, which is where the heart, quivers really instead of beating properly. And so he is on heart medication for that. He has some depression, some mild confusion, dementia, not too bad really. But so he has several health issues at this point. And the woman I'll call Mindy is in her early 50s, attractive but very gaunt. And she's gaunt because she doesn't eat very well. She's often constipated. Why? Well, because she's on a lot of different pain medication, methadone and OxyContin. Why? Well, that's because the result of a medical error, surgical error that cut the vagus nerve years back. And so she's been in lingering pain, has had some many problems, medical problems associated with that. So these are two of my clients. So as a professional advocate, I work with them. And so with Cal that one of the issues was that his team of physicians and practitioners, mostly at the Veterans Administration, but then he has a doctor who's not in the system, weren't really communicating very well. And so the medication that he was on, it has some real tricky instructions for it. Pradaxa, it's a fairly new blood thinning medication. And he wasn't quite sure of how to take it, and with a little forgetfulness.
Into mid-size and larger companies, and they're continuing to go up faster, even after you adjust for variations in geography, demographics, and benefit levels. I share, or I don't share, exactly the same perspective on the 2006 law when it comes to small businesses. It's been a real success in many areas, but I think for small employers it's been a little bit of a disappointment. Let me explain why I think that. You know, the merging of the market, small business and individuals purchasing insurance, I think ended up hurting small business a little bit. I think premiums went up a little bit as a result. Maybe that's an okay goal for us to be able to help those sicker individuals that were purchasing insurance before, but I think we must acknowledge it. I think another thing is state mandates have been very tough on small business. There have been 8 additional mandates passed in the legislature since 2006, and I think that there's not quite an understanding that those fall disproportionately on the shoulders of you all. Large companies don't pay for state mandates, they're federally regulated, and so it's individuals and small businesses that are paying that
employer
price.
clients, but we also do a healthcare reform survey to ask them sort of where their minds are at and what they're doing relative to their firms with that. So interestingly enough, the recent survey that we got back, and this has sort of changed over time. When this law first rolled out, a lot of employers were, oh, we got plenty of time, 2010 to 2018. So they was sort of, you know, it wasn't top of mind. They thought about it, but they weren't really doing a lot of things. They wanted to wait and see what was going to happen. And that still kind of exists to some degree, but many more employers now are getting a little nervous about, whoa, this thing is in place, it is the law, there are things we need to do to implement, and how do we, you know, manage the costs in the long run. But interestingly enough, the recent survey indicated 48% of employers were concerned about the excise tax that's going to take effect in 2018. That's 6 years out from now. We've got 2 general elections in the meantime. A lot could happen between now and then, but they're thinking about it. So that's a good thing. And the fact that that percentage, 21% of these employers have said, we are going to do everything we can to get our plan costs below that threshold of $10,200 a single and $27,500 a family, so that we're not